Hi, my name is Dr. Chris Hourigan. I'm a leukemia doctor, and I run the Laboratory of Myeloid Malignancies at the National Heart, Lung, and Blood Institute at the National Institutes of Health in Bethesda, Maryland, USA. I've been asked to talk to you today about how we can detect AML earlier. Now, this is a great question. As you may already know, acute myeloid leukemia, AML, is a blood cancer, and it's diagnosed around 20,000 people a year in America, where I currently live and work. While the average age at diagnosis is 67, it can affect people of any age, from the youngest babies to the oldest adults. And unfortunately, it's one of the more fatal cancers. So we're all really interested in trying to detect it sooner so we can intervene and prevent it. The way my team at the NIH is going after this is by focusing on patients with AML who have an initial response to treatment, what we call a remission, and then later have the leukemia become detectable again, what we call a relapse. Our theory, or hypothesis, is that if we looked harder with techniques not yet routinely available in clinical practice, at those in a remission, we could find low-level traces of their leukemia left in those who would later go on and experience a relapse. And we call this measurable residual disease. Lots of groups around the world are working on this, and it's even being used clinically by some. But our approach is to systematically work out what's the best way to measure in terms of what tools we use to test with, when we test, what we test. Do we test blood, bone marrow, fractions of these? And so we can come up with an integrated approach that's both sensitive, so we can find those people who are at risk of relapsing, but just importantly, is also specific, so we don't tell people they're a relapse if they won't. So once we have established the rules for this, the next step's going to be to move backwards and look in people who aren't even diagnosed yet, to look in those people at high risk of developing AML due to a family history, chemotherapy or radiation exposures, or other factors, to see if we can predict who will, and just as importantly, who will not develop AML. So it's a long process, but we've built a really great team, both in my own lab, but also with collaborators around the world, and we're making really great progress.